Performing abdominal thrusts. First, position yourself behind the choking victim. Now, it may be necessary to adjust the height of the rescuer or rescuee by one or the other dropping down to their knees. Once in the appropriate position height-wise, pull the victim until their back is flush with your chest and your abdomen. Extend your arms out underneath the level of their armpits. Make a fist with your dominant hand and place it just over top of the victim's navel. Take your non-dominant hand and place it over top of your fisted hand. From here, roll both hands up until your thumbs are facing towards you. Turn your head to face either the right or the left to avoid getting struck in the face by the victim's head while performing abdominal thrusts. Once in position, begin to pull up and in forcefully and continuously. If abdominal thrusts are not successful at clearing the obstruction, initiate use of the LifeVac airway clearance device per your institutional protocol. If the choking victim becomes unresponsive at any point, immediately begin CPR. If abdominal thrusts are not successful at clearing the obstruction, initiate the use of the LifeVac airway clearance device per your institutional protocol. The LifeVac can be used with the victim in the laying, sitting, or standing position. I will be demonstrating with the victim in the laying position. Choose the appropriate mask for the appropriate victim. The masks are clearly labeled adult and pediatric. To attach the mask to the suction unit, use the steps of place, push, and twist. Take the stem of the mask and place it in line with the receiving port of the suction unit. Push and give a quarter turn twist. Check the mask to ensure that it is firmly secured to the suction unit prior to use. Now that your device is ready for use, use the steps of place, push, and pull. You're going to place the mask over the victim's nose and mouth. Push down to ensure that the mask is firmly secured to the victim's face. Tilt up on the chin to position the victim's airway. Push down on the handle of the suction unit. Once the handle is depressed, pull the handle upward with a short, swift tug while holding the mask firmly in place. Roll the victim onto their side and attempt to clear their airway of any debris. Also check the mask and the suction unit for any debris. Repeat these steps for up to 5 times. If the object has still not been cleared from the victim's airway, return to following the established choking protocols, and if the victim goes unresponsive at any point, immediately begin CPR. Thank you for participating in this adult choking emergencies training. I commend you for taking proactive steps to ensure the safety of you and your community.